I'm going to say this. We have pretty good health care. I work for Communities United for Action. It was my job to make sure that we had good health care for our employees. But even though Communities United for Action covers a good portion of that, I'm paying something like $1,000 to $1,100 a month for private health insurance. That's for me, for my husband, and for one of my kids, because their dad insures the other one. And one of the things that we have to do is actually, because the private health insurance, even with my employer covering a large percentage of it, is so exorbitantly expensive that it violates the Affordable Care Act, right? The Affordable Care Act has a measure of a standard of care, right? So it's more of a percentage of our income than it's supposed to be, even having the employer pay a portion of that. So we get health insurance for my husband through the Affordable Care Act, through the exchanges. And we get a very little subsidy for that, but it amounts to about $100 to $200 a month, right? Money that I am using to buy groceries, to feed my kids, right? So if this budget bill goes through the way that they want it to go through, you guys remember when the Trump administration and the Republicans in Congress had control of Congress for about 2 years, starting in 2017, 60 times they tried to get rid of the Affordable Care Act, and they couldn't do it, right? The closest was one vote, right? John McCain. And so if they get away with what they want to do and they get rid of those subsidies and they get rid of the provisions for pre-existing conditions, our healthcare is going to skyrocket. I'm going to have to start cutting things. Probably the streaming services will go first. Like my son said, we could get rid of some of the streaming services. But the next thing that's going to go in my disposable income is things like groceries, right? Just to be able to afford healthcare. And that ain't right. We should all be able to have health care. And I'm concerned about Medicaid too, because if, just like you were talking about, Meg, if they start defunding Medicare and Medicaid, many of our hospitals' budgets depend on that income, right? And where are people gonna go? They're gonna go to the emergency room. That is gonna increase everybody's healthcare costs, even if you're like me getting it through private insurers. So this is something that I feel like is gonna impact every single person who gets healthcare. That's all of us. If they get away with $880 billion of cuts to our healthcare infrastructure. That's what I wanna say to Houston and Davidson and Bernie Moreno, who don't have the courage to listen to your stories today.